My name is Dr. Orie Quinn. I'm here at Ozark Holistic Center, and today I want to talk to you about a particular problem that we see in the office that's actually very near and dear to me, which is that of thyroid issues. And the reason why is because my wife suffered with that and had that for quite a few years when we first got married. When we first started dating, she had been diagnosed with hypothyroidism during a time that was really very stressful for her. She was working management in a corporate job, had a lot of things changing, a lot of things shifting, and so with that, she had seen this great reduction in energy levels. She was having a hard time waking up, getting going during the day, which only compounded the stress level. She was also starting to put on some weight, and she wasn't understanding why, as diet hadn't really changed, exercise level hadn't changed. And so she tried at first to try to offset some of these things with additional exercise, trying to get away more, doing those kind of things. And while that seemed to kind of help, it wasn't really making the big change that she wanted. Ended up in the doctor's office, ran some just simple blood panels, and found that her thyroid levels were off, that her TSH was high. And so that's where it all started. And so it seemed to do the trick okay, like it seemed to help her stomach kind of rebalance and restabilize. And then you fast forward a couple years later, and we're in chiropractic school. I'm going through chiropractic school, and we start learning more and more about the thyroid, some of the more extensive things that can be tested, what you were actually looking at. And so we ran more extensive tests, which are the tests that we run here in the office when we find that we believe that someone might have a thyroid panel, which usually includes T3, T4, TSH, reverse T3, and your thyroid antibodies. And with those tests, we're actually identified that she didn't really have hypothyroidism. She had a unique form known as Hashimoto's, which is actually an autoimmune condition to the thyroid. And with that, you immediately have to look at food sensitivities and possible food allergies and identify what you need to take out. The most common one is gluten, and in her case, removing the gluten ended up doing the trick and making the big change that she needed to get those energy levels back and make that change, and eventually make her way off of those medications. And so that kind of set the stage for my interest in this particular area and in this particular health problem. And so, again, that's the first thing we'll do. When someone comes in and we suspect it might be a thyroid problem, there's just a couple really simple, again, blood works that you can run, and the overall cost really isn't that expensive in order to identify that. Once you identify it, you can piece together specific nutritional needs, because sometimes that can be the cause. Sometimes it's, again, mineral deficiencies, vitamin deficiencies. Sometimes, again, it's food allergy and food sensitivity that you need to be looking at. And so once we identify those, it's a bit of a process. It takes months to kind of change these, because there's some lifestyle changes that often have to come with it, but you can get back to that position that you want to be in. We actually just had a lady come in here several months back, ran her blood work. She came up with a TSH level of 12, which is actually one of the highest ones I've seen in my time in practice, which TSH is normally supposed to be 5. We identified with hers it was food. We had to remove gluten and dairy as the 2 components, starting her on some of the deficiencies that she had nutrition-wise and supplement-wise, and even herbal-wise, because there's some great herbs to help with that as well. 3 months later, came back in, reran that blood work, and she was down to 6.0, with her other inflammatory factors greatly decreasing. And so while she's not all the way there yet, her energy levels restarted coming back within just a couple weeks. She started sleeping better, feeling a lot better, and some of the added weight that she put on is starting to come off as we're seeing those levels come back even into more normal range. And so this is an area that, again, rather quickly and rather simply, we can actually be able to identify, put people on the right program and protocol in order to help kind of return people's lives back to normal. So it's a really neat thing to be able to help people with.